name is Megan. I'm one of the labor and delivery nurses here at Parkridge on our third floor of the Birthplace. We know that with COVID, a lot has changed. A lot of your birthing classes and breastfeeding classes are getting canceled. A lot of your support persons are not able to even really come to hear the baby's heartbeat or come to your appointments with you. So in all of the uncertainty and the changes in the way that we do our everyday life, we wanted to say welcome to Parkridge and give you a little expectation before you come in to have your baby. So here we are at the emergency department at our Parkridge location. We know that there are times when you may not know what's going on, but you know you need to be seen. So day or night, you can come in through the emergency department here. When you come in, you as an obstetrics patient are allowed to have one support person for the whole time that you're here. And then you guys will go through a safety check as well for COVID monitoring. We'll check your temperature, they'll have you wear a mask and sanitize your hands, and then they'll escort you up to the third floor. So let's put on our masks and go up to the third floor together. Hey, welcome to the Birthplace at Parkridge. I'm Megan, and I want to take you on a little tour around our unit. I know with COVID, we've not been able to do our normal Birthplace tours and classes, so we just want to give you a little bit of a sneak peek into our unit and what to expect when you come to have your little baby. So come on. So we actually have, we hope that all of our moms and babies are going to room in together and stay in the same room for the whole time that they're here, that you guys are here with us. But right here is our newborn nursery, so if for some reason your little one needs to go take a visit there, family and friends can see through the window. So you'll check in at the Birthplace at labor and delivery. Miss Beth will be here to meet you. Hello. And we'll get you signed in. So if you don't really know what's going on with your pregnancy, you've got some things you need checked out, you can come take a visit in our triage unit, which is sort of like an emergency department for OB. So we'll show you one of our triage rooms.
Would you like to sign in and give me a copy of
Let's go see one of our triage rooms. So this is our triage bay, and also on the way to our operating rooms in case you come in for a cesarean section. We'll probably get your urine sample here. And we'll get you set up on the monitor. We like to check in with baby's heart rate, see if you're contracting, and just kind of ask the basic questions at first to see what's going on with you if we're not sure what you have going on. If you're a scheduled C-section, this is actually our favorite, our darling C-section pre-op room, where we're going to start your IV, we're going to get your information from you, all the doctors, all of our team members will come meet you prior to going back for your C-section, and then we'll get up and walk to the OR to have ourselves a birthday party. So you're staying to have a baby. Your water broke, and now it's time to get you in a labor room so we can have ourselves a birthday party. So we're going to leave our triage area. We're going to come out back to the nurse's station and get you in a bigger labor room. So before we get started with laboring, we're going to get your IV in, make sure we have access so we can get you fluids and any medications that you might need. We'll always let the anesthesia team know that you're here too, so that when you're ready for your epidural, they'll be ready for you, okay? All right, 3325 is where we're gonna B. So this will be your labor and delivery room. Every room is outfitted to have our baby warmer here. We do our epidurals in here. You will labor, you will deliver in here, and then you'll recover in here. So you'll stay in this room from the time we admit you for labor until about at least 2 hours after delivery to make sure that you and baby are both doing well and that you're ready to go to your postpartum room. And when we take you to your postpartum room, you and baby will stay in your room together for the rest of your stay until it's time to go home. So we have our recliner, so your support person can kick back, take a nap, or you can even rock in it during labor. We have a little pull-out chair here that you can pull out into a sofa bed. And then, of course, for your comfort in labor, we have a birthing ball, we have peanut balls, we have different things that we can do to support descent of the baby and also your comfort in moving around the room while you're here for labor. Here's our bathroom. We have a shower in every room. That you or your support person can use. And my favorite part is the view. Lots of natural light. All right, so we're going to take you back to the operating room. Even with COVID, obstetrics, we've been allowed to keep one support person for every mom because we believe that's super important for you to have your support person whether you're doing C-section or labor and delivery. We come back here. Usually Dad will take a seat in one of these chairs and wait for us to get you comfortable, get you ready for your C-section, and then we'll come grab him after we're all ready to go, set up and ready to go in the operating room. We have 2 operating rooms on our floor, and they're really close to the labor and delivery rooms. You can almost always expect for there to be music going, so don't be alarmed. We just like to have some fun because it's a fun time. We're here to have your baby. So in every C-section, there is a team that you can expect. You're going to have your anesthesia nurse, you're going to have your anesthesiologist to make sure your pain is well controlled. You're going to have your newborn nurse over here by the warmer and your respiratory therapist. Those 2 especially, they always come to every delivery so that we can make sure that your baby is going to have that very attentive care. You'll have your nurse in here as well as the scrub techs and of course your OBGYN doing your C-section. So no matter when you come in, we always have an OBGYN here in the hospital. They take 24 hours of calls, so they're going to be here even in the middle of the night, right down the hallway. So no matter what happens, you have a doctor right there in the hospital with you. If you come into triage and we don't know what's going on and we're here to figure that out, you're going to always be seen by one of our OBGYN physicians. So here we are on Magnolia Suites. This is our nurses station with a few of our awesome nurses. We have 20 postpartum rooms up here. We have couplets that stay, and when we say couplets, we mean a mama and a baby staying in the same room for the whole time. And we also have some gynecological surgery patients that come up here to recover as well. So after you deliver, we always stay, like I mentioned before, we stay in that labor room for at least 2 hours to make sure that you are good to go, you're recovering well from your vaginal delivery or your C-section delivery. And then we'll come bring you down to Magnolia, which is our postpartum unit for moms and babies. Baby will stay in here with you, and each room has a private bath, and then the same recliner and pull-out sofa for your support person to sleep as well. So for your recovery from delivery, you're going to always have an OBGYN who's going around on you each day to check in, review your chart, check in with your nurse and make sure everything looks good with your recovery. The baby will have the neonatologist or the pediatrician come by and see baby, and then anesthesia will also come and check on you, make sure you're recovering well from either surgery or epidural and that your pain is all right. We have lactation consultants here almost every day to help with breastfeeding and get you off to a good start. And all of our nurses here are also trained, and we've got lots of education hours under our belt to help you with lactation needs and breastfeeding support day or night as well. So if your baby does need to go to the nursery, we have visitation hours from pretty much all day and all night, with just the exception of morning and evening shift report to protect the privacy of all the babies in there when nurses are handing off report. You can come in, ring the doorbell, and then that will signal to the nurse inside to see who you are, get your privacy information, and then let you in. So I'm just going to bring us on in so you can see how to scrub your hands and wash up. Every parent, they come over here and do a surgical scrub to get nice and clean before going into the nursery. And then usually we'll have you put on a fresh gown just so that we can keep everything as clean as possible so that you can snuggle your baby, do skin to skin, or even practice breastfeeding in here, or whatever you may want to do while keeping it nice and clean for everybody else. We're so excited that you're coming here to have your baby with us. From the doctors and the nurses and all of our staff, we're super excited to see you at Parkridge. We know that during the pandemic, we have not been able to bring you in for tours. A lot of your breastfeeding and birthing classes are getting canceled, and it's overall just a really stressful time. So I really hope that taking you on a little virtual tour and just giving you the lay of the land here at the Birthplace at Parkridge will give you a little bit of familiarity and kind of get you excited for coming in, even in the midst of all of these unknowns. We'll see you soon.